Welcome to another episode of the Your Company Health podcast. So glad that you joined us today. Today we have Dr. Dayna Smith, a physician here in Atlanta. Good day, Dr. Smith. How are you?
Hello, thank you for having me on your podcast. I'm doing well, thank you, Andre.
I'm ecstatic. So to get things going, I want you to tell us who you are, who you work with, and what you do for your patients.
So I am my name, Dr. Dayna Smith, you've already said that, and I am an OBGYN physician. That means I work exclusively with women, mainly women of reproductive age through menopause. And currently, I work as a hospitalist, which means that I work with a hospital and I'm a part of a group that provides 24/7 coverage at the hospital, and we rotate taking shift work basically to provide coverage for any lady that comes into the hospital that needs obstetrical services or emergency GYN services. If they don't have a physician on staff, then either myself or one of my teammates would provide care for that patient. So that's what I do on my day-to-day. However, what I'm also doing is I've started a website called myobmd.org, and it's myobmd.org. I'm really excited about this site because it really highlights what we do is we write a lot about a lot of different patient medical information that affects women's health information. And all this information are written by physicians. So we are really excited to have that platform available for patients that they can go online and read up and know that they're getting medically accurate information, which I think is super important right now.
Yeah, well said, well said. And that's why we like to bring on, experienced healthcare practitioners like yourself on this podcast to tell their story. And whenever we bring people, there's always a backstory and why you're doing what you're doing. So, doctor, what are you passionate about in life?
I'm passionate about many things. The passion that has fueled this particular project is I felt as I see more and more patients and I spoke to more and more patients in our practice, I really became very gravely concerned that patients are trying to inform themselves on their health, which is a great thing. But the problem is that the information that they were being provided, a lot of it was inaccurate and some of it was downright dangerous. And I think that's problematic because some patients were really taking a lot of this information as gospel and practicing making changes to their health based on things that they were reading online. And I felt like that was really such a dangerous way for them to care for themselves. But I want to applaud the desire to be informed. And so I felt the best way to tackle this issue was to meet patients where they were, which is online. A lot of patients are online when they want to talk about their health concerns or they have questions. Unfortunately, your doctor's practice may be closed. You have to get an appointment. Your doctor is not immediately available. And so you're left to Google and try to find information online, but what's online may not always be accurate. And so I wanted to be a part of that solution in providing medically accurate information. So other websites, they have other so-called medical websites. Their information are written by medical writers. So you have a medical writer, they research the topic, they write upon the topic, and then they have a physician review the article prior to publication. We have shifted that paradigm. And so what we do at MyOBMD is we have the physicians write the article. The physician is the one that has the experience on this particular medical issue. So they write the article, and then the article is refined to make it more reader friendly. and then published. But the core information that you're getting from someone who has cared for patients with that particular medical issue. And so you're truly getting information right from the horse's mouth. It's accurate, it's real world information you can use and apply.
And that's, doctor, that is so important, because sometimes you're just not feeling well and you go on Google and do a Google search and you'll see like the worst things, right? So it's always so important to, go see your doctor and find an experienced professional that you can talk through the symptoms, and so that you can get the right diagnosis. So great information, and I really applaud you for what you and your team are doing.
Thank you.
So to keep things going, what do you say is the best business advice you've ever received, and how did this impact your journey?
Okay, so business was new to me because I've never had a business. I'm not a business owner. And so starting with my OBMD, I think I was a little naive because I just felt like, okay, I'm going to write these articles. And at first I started off with writing myself. I wrote on nutrition in pregnancy and weight in pregnancy and so forth. And I just thought, oh, people will find it, patients will find it, because this is really very good information. Well, of course, Andre, we both know that is not how it works in real life. That information is within a sea of other information. And so it's very hard for people to find it. So I have hired a marketing team to help with that. I think as far as the advice that I've been given that has helped me, that I use very frequently, is I remember either reading somewhere or someone telling me, hey, do not hire anyone you cannot fire. And I think that was really excellent advice, because sometimes you have a friend or a family member, a colleague, and you may have a need within your business, and you say, oh, this person, I remember them, they do this, or they went to school for that. But you really don't know if they're a good fit for your company. And if they're not, now you're kind of stuck, because you're worried about if I let this person go, how will it affect our friendship or relationship outside of the business? So I really like to keep my relationships pure. I like to just hire folks that are not within my personal circle. That's just my personal preference. And so that allows me to keep it pure. And if they do a good job, then they're going to get into the friend and family category anyway. But then if they don't, then it's easier to make a clean break.
Yeah, and that's a very good observation, and I can see how that has impacted you on the journey. If you would say, what are some 3 biggest mistakes you see your patients are making on their health journey?
So I think patients who are on the health journey, first, we applaud them for being on a health journey. So we always want to recognize that there are those that are just not even putting their health on their radar. And so for those that are making their health a priority, we applaud that. So what could we do better? No matter who we are, we always have room for improvement, in my opinion. And so what are some of the things that folks can do to maybe kind of help themselves along the way? I think one thing is recognizing what your needs are, because everyone's needs are different. So some people, it may have a desire for weight loss. That's a popular health goal, but it's not the case for everyone. Some folks may feel, hey, I'm really stressed out and I'm having a lot of anxiety over my schedule. I'm having Sunday evening chest pains because I'm worried about work the next day because my work-life balance is really not where it should be. So, or they may have a relationship strain that's causing health problems. So I think first is to be reflective and to be honest with yourself about what your needs are, not what someone else is telling you your needs are. And that goes a long way, because then you'll at least have the recognition of, hey, this is what I need. Now, based on that, you recognize what you need. You then have to figure out a solution. Okay, how am I going to fix, what is my plan to fix this need? I say when you're trying to formulate a plan, build a team. Build a team. If you do not build a team and you only rely on yourself, we are all human. We are going to become discouraged. And once, no matter where you are, no matter how motivated you start off, it's human nature that our motivation will wax and wane. And so we need to be a part of a team, of a support team, so that when that motivation is low, you can call on someone to help pick you up, to keep you on that, so you don't quit. And then lastly, you have to make the solution that you have decided on, you have to implement it. You have to execute it, right? Because a plan sticking on your wall does nothing for you.
That's true. That's true.
It's nice that you have it up on your wall so you can see it every day, but yeah, you actually have to implement it. And in regards to implementing and executing your plan, be patient with yourself. Be very be kind to yourself, because you're not gonna start off and get it right just like that, right? It's a journey, like you said. So you want to always be kind with yourself, be patient with yourself, but stay on the journey. Just stay on the journey, no matter what.
Well said. Well said. And I want to give our listeners an example of a great client outcome, and you're excited about it.
Let's see. Well, I cannot go into
in depth, right? You could just generalize.
I cannot. Okay, but in general, what I consider to be a great outcome is when both I take care of. We have two patients as obstetricians. We have mom and baby, right? When the baby is in utero. So most of the time at my job, I take care of patients who are laboring, going through the process of giving birth. And so a good outcome is a healthy mom, a healthy baby, no complications, where mom can look back and feel satisfied that her process throughout that labor process, she was heard, and that we respected her wishes, whatever she wanted or didn't want, that we were respectful of that, and that we acted as a team. And so she feels positive emotions when she reflects back on her labor experience. So the first thing is, of course, a great outcome, healthy outcome for mom and baby. And secondarily, you want to make sure that mom can also, or the family actually, can look back and feel that it was a positive experience.
Yeah, well, it's always a good thing when when that it's because of your efforts and your mentorship and guidance why there's a great outcome. So I completely understand what you're saying. But doctor, let's change gears a little bit. What are your thoughts on digital marketing?
Digital marketing. Oh my goodness. So, this business has created such a learning curve for me. It really has. And so the digital marketing, I'm going to be honest, I really do rely heavily on my team for that, because that is their area of expertise. And so my team has been fantastic with putting out information to help to increase our visibility, increase our range and our reach within different communities. So I am very much in favor of digital marketing, but I cannot speak to the ins and outs of it. I apologize, because I really do rely heavily on the team to take care of that for me. And I'm spoiled, I will admit.
But I mean, that's really good what you're doing, because it shows that you know the importance. And as you mentioned before, when you were talking about people are searching online and finding all this information, there's a stat shows that over 1 billion healthcare related searches per day on Google. So people are always searching. So you're completely right. So it's so important that you have that digital marketing team, and I'm glad they're actually, helping with your strategy. But I'm telling you, not all healthcare practitioners, they see it as you and know the importance of it. So kudos to you to, know the importance of that and using that as a fuel to drive your practice. So I know you mentioned to me about your podcast coming up, but tell us about some of the tactics you're using to drive growth in the practice.
So really to drive growth to my website. So we employ different strategies. We have one, we want to make sure the physicians within the community are aware of the website, and so they can share that information with their patients. So when their office is closed and their patients want to research information, they can say, hey, go to this website if you have information until our next appointment, when you're able to ask me directly. So we can provide that stopgap for the patient so they can have immediate access when their physicians are not available. Then, so outreach within the community, that's one. We do Google advertisements. So we do ads on Google for certain topics. And one particular topic we have found to be very popular is we have an article written up about C-sections. So, I realized a lot of patients, they don't really know the process if they're scheduled for a C-section. So I went through and I wrote an article very, very detailed about from the office to the hospital to the surgery to recovery. And so the patients can get a step-by-step knowledge before they even come to the hospital on what to expect if they are scheduled for a C-section. So we have found that to be one of our most popular articles. And because, like I said, you're getting real world information. So you're getting it straight from the person that has done C-sections, that has so many hundreds of patients that I've had this perform the C-section on. So I'm very familiar with this process. And so I'm very proud of that, because I feel that when patients are able to read that, then that can really relieve some of the anxiety for their family members, their partners on the day of their child's birth, and they can relax and have a more pleasurable experience. So that's also another way that we market, is by Google advertisements. Trying to do more social media. I must admit, I'm not social media savvy like some of my colleagues are. And so we are working on that recognition, number one. So I recognize that, and I'm building the team to help us address that, because again, also that's where a lot of people are, that's where a lot of patients are. So regardless of how we feel about it, that's where people are, and we're trying to get the word out. So we do have to get more on that platform. And so we are also building up our social media platform as well. So the Google Ads, community outreach, and social media.
Mm-hmm. How about tell us about the podcast?
The podcast. Okay, so the podcast, we are getting ready to launch that podcast. Let folks know about some of the topics that we cover on the website. So I speak on some of the medical conditions that we cover on the site. So we're also hoping to get guests that can also come on and discuss different things and different topics as well. And so hope to have more information on that launch.
Of course, of course. And those are all great strategies. And I know that when you have everything implemented, it's definitely going to drive even more traffic to your website and more patients to your practice. So it's all good things, all good things. And doctor, I can't believe we're almost at the end. You know, we could go on forever. All right, but I wanted to tell us, you know, if there's one thing that you're not investing enough in, and you will prioritize this year, what that one thing be?
So let's see. I think inserting myself in the marketing process. I think right now the marketing process has been, I've really pushed the articles and the information as the real marketing tools to be used. But as one of my team members says, everybody wants to know, where is this information coming from? And so I will be inserting myself more, becoming more of a face for my company, more of a brand for my company, so that people will be able to know that, hey, this is not just a random person or robot that's putting out this information. It's an actual practicing physician that is created this platform and is putting out this information. And so yes, I need to and hence I'm very grateful for this opportunity. I think this is a great launching pad for me to get that going, so that everyone can see that there is a team, not just myself. I have a group of physician writers, but yes, I am the founder of myobmd.org, and I intend to let more people know that.
Mm-hmm. Awesome. And Doctor, great information. And I know our listeners and viewers there, you know, they got a lot out of this conversation. And will you tell us, how can we, if someone is listening, they want to reach you, how can they reach you?
So the website is myobmd.org. We also have Instagram and Facebook site, and also at myobmd. And my email is info@myobmd.org.
Nice. Perfect. And obviously we'll put that up on our site too. If someone is watching or listening, they could actually reach out. Definitely. Well, that's it. We're come to the end of the podcast. Doctor, thank you so much for joining us today. It was a great conversation, and I know our listeners will check you out and learn more about your practice.
Thank you, Andre. Thanks for having me.